Good day everyone, my name is Gigilin Velasco from sasn, Quezon City. So now I'm performing surgical gowning and gloving. Do the surgical hand scrubbing procedure prior to entering the OR theater. This prevents the transfer of transient microorganisms. Once the inside the OR, dry hands with a sterile towel. This decreases the resident microorganism to an irreducible minimum. The circulating nurse standing at the opposite side of the table will assess the scrub nurse in opening the wrapper of the sterile gown. The circulating nurse can only touch the folds of the wrapper, and after the wrapper was opened, then the circulating nurse moves back away from the area. This maintains the sterility of the gown. With one hand, pick up the entire folded gown from the wrapper by grasping the palm through all the layers. This avoids contamination of the gown. Once your hands are securely, clean hands can touch inside of gown without contaminating outer surface. Step back from the shelf and allow the gown to drop. Make sure the gown does not touch any surrounding and sterile object. This prevents the nurse from touching the sterile part of the gown. Grasp the inside shoulder seams and open the gown with the armholes facing you. Again, clean hands can touch the inside of the gown without contaminating the outer surface. Carefully insert your arms partway into the gown. Carefully insert your arms partway into the gown, one at a time, keeping hands on at shoulder level away from the body. This prevents contamination of the gown. Slide the arm further into the gown sleeve, and when the fingertips are level with the proximal edge of the cuff, grasp the inside seam of the cuff head using a thumb and index finger. Touching the outside of the gown will break its sterility. A circulating nurse will fasten the gown behind you, positioning it over the shoulder by grasping the inside surface of the gown at the shoulder seam. Note that the circulating nurse is only allowed to touch the inside of the gown to maintain the outside of the gown sterile. The circulating nurse then prepares to secure the gown at the neck and upper back. The circulating person then ties the gown at waist level at the back. This secures the gown. The scrub person will take hold of the belt tab, which is securing the belt ties. Keeping hold of the left inside tie with the left hand, pull the tab with the right hand things still secured and hand the tab to the circulating person. This approach keeps the tie sterile. The circulating person will take hold of the tab, forceps being very careful not to touch the tie, and will move to the side of behind the scrub person. The scrub person will then turn if necessary to enable them to reach and retrieve the tie. The circulating nurse can touch a tab because it is intended to be removed after downing is done. When the scrub person is properly positioned, they will then take hold of the belt tie, only being careful in to touch the tab or forceps and pull on the tie leaving. The circulating person with only the tab or forceps in their hand, the circulating person must hold on tightly to the tab or release clamp of the forceps so that when person pulls on the tie, the tab or forceps does not come with it and contaminate them. The tie should be carefully moved to maintain the sterility of the gown. Finally, the scrub practitioner will secure the ties on the left side. The scrub nurse can touch the ties when wearing sterile gloves because the ties are considered sterile as well. The scrub nurse must have performed the surgical scrubbing and put on the sterile gown before attempting to fit in the sterile gloves. This procedure removes transient and resident bacteria from the fingers, hand, and forearms. The help of the circulating nurse opened the first package of the gloves, making sure not to touch one inside package. If gloves are already available at the table, open the inner package containing the gloves and pick up one gloves by folded cuff edge with the sleeve covered hand. This is to maintain the sterility of the gloves and prevents transmission of bacteria from circulating nurses' hands. Place the inner package of the gloves on top center area of the sterile drape or sterile wrap of the gown. Place the right glove on the right gown sleeve, found down with the glove fingers pointing toward the shoulder. The palm of the hand inside the gown sleeve must be facing upward towards the palm of the gloves. Position glove for application over cuff hand, keeping the glove sterile. Place the gloves rolled cuff edge of the seam that connects the sleeve to the around cuff.
Rest the bottom rolled cuff edge of the glove with the thumb index finger. While holding the glove's cuff edge with one hand, grasp the uppermost edge of the glove's cuff with the opposite hand. Outside of the gown is a stereo surface. Once our hands can touch gown, it will be contaminated. Continue to grasp the glove's stretch and cuff of the gloves over the hand. It initiates better way to put the gloves without contaminating it. Using the opposite sleeve covered hand, grasp the both gloves cuff and sleeve cuff seam and pull the glove onto the hand again. It initiates a better way to put the gloves without contaminating it. Using the hand that is now glove, put on the second glove in the same manner. When gloving is completed, no part of the skin has touched the outside surface of the gloves to make sure that each ground cuff is secured and covered completely. This ensures that the nurse has full dexterity while using the glove hands. Once the sterile gloves are on the scrub practitioner, he or she is ready to secure their gown with assistance from the circulating person.